How many fasts have you supervised? Has anyone died during a water fast you've ever overseen?
Valid questions. During my 8 years at True North, I supervised well over 2,000 fasts in 8 years. And Dr. Goldhammer has supervised over 20,000 fasts in his 25 years there. But we had a good 2,000 coming in after during my tenure there. And knock on Formica, nobody died, nobody came even close. But again, we have interns there. We are checking you twice a day. Everyone's got a doctor button on their phone. We tell them any nausea, any headache, you're getting lightheaded, you tell us. You hit that button, we want to come and check you. So we're hovering over them. This is nutritional medicine done right. And that's why nobody's gotten into any trouble. And if anyone looks like they're going to vomit or they got this terrible headache from low blood sugar, that's the end of the fast. They can always come back and do another fast. Fasting is never an emergency. And the most important thing is our safety. And so time for some juice. You can come back in a few months, try another fast if you want, but we don't take any chances with them. So no, it's a remarkably safe thing when there's competent supervisors around. And nothing bad's happened there at True North.
What have been the results of the fast you've overseen? Have people resolved major health issues?
The before and after picture you see of these people, and sometimes they send us literal pictures, but the clinical picture, these people come in obese, high blood pressure, on a bag full of pills for their diabetes and their inflammatory states and their blood pressure and their cardiac arrhythmias and their bowels and their sleep. And they go through the fast, but very importantly, they learn how to eat afterwards. And you see them back as an outpatient. And sometimes I don't recognize them when they come through the door. They've dropped 60 pounds. Their face looks different. They got a spring in their step. Doc, I'm off all my pills. My doctor can't believe it. I haven't had angina since I left here. The stories we get, they fill a Ripley's Believe It or Not book. Some of them are even hard. They stretch credibility, but the person sitting in front of you. And I had such bad arthritis. I was making rounds one day. A woman had severe rheumatoid arthritis. It hurt to look at these red swollen joints on her hands. I felt so bad for her. She did a 26-day water fast. And on day 23, I come in and making rounds with the interns, and she's got tears rolling down her face. And I said, are you in pain? Anything distressing you? She said, no, this is the first time I've been able to make a fist in 20 years. I've never seen my hands move like this. And I just went up and hugged her to celebrate that. Stories like that are quite common, and the responses we get can be that dramatic. But again, depends what she eats afterwards. If she falls back into her old habits, and chicken and dairy are notorious for making us flare up again. But the stories we've seen, Dr. Goldhammer, who runs True North, has folders this thick of these kind of people who've had these remarkable improvements. I tell the interns, listen, I'm the happiest doctor I know. My patients get healthy right before my eyes. The cardiologist, everybody needs stents and statin, they all going to die of cardiac. Yeah, doctor, if you don't talk to them about what they're eating, that's what happens. But if you do, they get better. And the rheumatologist with the sore joints, and the gastroenterologist with the inflamed guts, and the dermatologist psoriasis, they get better. And that is why we went into medicine. And to see it happen with a fast and a plant-based diet, yeah, and it's elegant. It's free. It's cheap. I mean, water, it costs nothing to do nothing in a way, and just drink water and eat plants, and these diseases go away. What a powerful modality it is, and we must every medical student should know that from day one when he walks in. Certainly when they walk across that stage after 4 years and get their diploma and they call you doctor, you better know how to cure most of your patients with a whole food plant-based diet. And that's why we're doing our Moving Medicine Forward initiative, to get that information into the heads and hearts of the young medical students so they know about this powerful tool.
The media often reports that alcohol in moderation is part of a healthy diet. What do you think about alcohol's impact on our health?
My impression of alcohol's impact upon our health is a negative one. I've worked in so many emergency rooms, and I've seen what alcohol does to people, to their bodies, to their minds, to their spirits, and it's my most unfavorite drug from a completely medical, physical point of view. Alcohol kills everything it touches. We, in the hospital, dip our surgical instruments into alcohol because it kills any cells, bacterial or otherwise, that are on the scalpel plate. Well, alcohol kills whatever it touches. In Harrison's textbook of internal medicine, there's an alcohol toxicity syndrome for every organ in the body. It poisons the stomach, you get alcoholic gastritis. Poisons the liver, you get alcoholic hepatitis. And poisons the heart, you get alcoholic cardiomyopathy. Poisons the muscles, you get alcoholic myopathy. Poisons the nerve, alcoholic neuropathy. Alcoholic encephalopathy. It's a poison. Does it lower your cholesterol? I don't care. The damage that it does to the tissues directly. But now, in view of our microbiome and its importance to keep that healthy and balanced, in the hospital, we dip our instruments into alcohol to kill bacteria. Well, here we are drinking this stuff, the wine and the beer. Well, the doctor says it's good for my heart. Maybe so, but those microbes down your gut, they don't care about your heart. They just know that a big slosh of ethyl alcohol just came down, and that can't do great things for your microbiome. So, and I find in excess, of course, alcohol brings out the worst in human beings. They get aggressive and very unhappy. So, so I'm not a big alcohol fan. And you want to lower your cholesterol, stop eating anyone else's cholesterol. Stop eating cow's cholesterol and chick's cholesterol and pig's cholesterol. Do that first. And if your own cholesterol drops down to 150 like it usually does, you don't need to be drinking red wine or anything else. Your arteries will be healthy because your arteries are healthy, not because you sloshed ethyl alcohol down through your bloodstream.